Welcome to Metlacto. Today we are going to discuss Haemophilia-A. It is actually a genetic disorder in which you will see that when someone get injured, then bleeding start and it will continues without any formation of the clot over the injured side. But in normal situation, when someone get injured, then at that situation, bleeding will stop automatically at the injured side. So, in hemophilia A, there is a defect in the factor 8 deficiency, which is involved in the formation of the clot over the injured side. So, factor 8 is basically a protein and it is actually involved in the formation of the clot. When there is no factor 8, then the bleeding will continue and you will never see any formation of the clot over the injured side. So, in this lecture, we will discuss first of all genetics, genetic lineage and the clinical features of the hemophilia A. So, let's start. First of all, we will discuss the genetics. So, as we know that the hemophilia is actually a defect in the factor 8. Factor 8, which is actually the clotting factor, and this is actually protein in nature. So, as we know that the DNA convert into the RNA, RNA convert into the protein. So, this is the same case. This is actually a protein. If there is a defect in the DNA, then the factor 8 will also be affected. So, here you can see that this is the chromosome X. This is the sex-linked chromosome and factor 8 gene is present on the large arm of the X chromosome. Here you can see there are two arms. This is the small arm which is the P and this is the large arm which is the Q. So, factor 8 gene is present on the large arm of the X chromosome. So, here you can see at the end, near the telomere. So, if I zoom it, then it will look like this. In that situation, you will see that the factor 8A, factor 8A, factor 8A. So these are basically the different copies, and here you can see this is the factor 8B. So this is actually the factor 8 gene and this is the long gene, and approximately 26 exons exist between the factor 8 gene, and this is actually the normal conformation. But in sometimes this is actually the long arm of the X chromosome. This will rotate or flip and it will turn and backward, and you will see that it will look like this. When it fold around itself, then what will happen? In that situation, the genes copies will be front side of each other. So F8A and F, so here is the F8B. So in that situation, crossing over occur in between them. So here you will see the crossing over. But in normal situation, crossing over exists between the homologous chromosome. Like if you see that there are different homologous chromosome, XX chromosome, and the crossing over between these homologous chromosome. And if we see in the male case, there is a X chromosome and there is a Y chromosome, XY chromosome, then crossing over exists between homologous chromosome. But in that situation, only one chromosome turn around itself and exchange its material. Then in that situation, you will see that one copy will remain at the telomere side and the other will move upward. So in that situation, F8A, F8A, and here is the F8B. So in that situation, when it transcript, when the RNA polymerase transcribe this gene, then you will see there is a defect in the factor 8. So this whole process in which the arm of the X chromosome turn around itself, so this whole process is actually called the flip tip component. flip tip process. So in that situation, you will see that the factor 8 will be defective. And there are other genetic defects can also exist, like deletion, insertion of the nucleotide in the DNA sequence. So this is the basic reason which affect the factor 8. So next we will discuss the genetic lineage. So it will be easier for you in understanding hemophilia A. So here you can see this is the female and the male when got married. Then what will happen? If the female is the carrier, so in that situation, this is the X chromosome, and this X chromosome which is shown by the node over the X chromosome. So in that situation, this is a carrier state. In that situation, female case, only the one X chromosome affected. This is actually the carrier state. When there is no, when you will see, there are three possible situations can exist in female. One is the normal case, when both the X chromosomes normal. When one X chromosome is affected, then it is called carrier state. When both the X chromosomes affected, then it is actually the state in which you will see the hemophilia A. But in male, you will see only two situations, XY, that is normal. And in that situation, if X is affected, then you will see this is the hemophilic person. So it is actually a carrier female and the male is normal, that is XY. And if we see that four possible situations can exist between them. If we see that this chromosome exchange with this one, this chromosome exchange with this one, then you will see that this will be XX state and this is female daughter. That will be the daughter of these parents and that daughter will be normal. If this X chromosome exchange with this Y chromosome, then what will happen? Then it result in the X and Y chromosome, and that son will also be normal. And if this X chromosome, which is actually affected X chromosome, exchange with the normal X chromosome, then in that situation you will see that the carrier daughter, in that situation one X chromosome is normal but other is affected. So if this X chromosome exchange with the Y, then you will see that this is the affected X and this is the normal Y. But in that situation you will see that this person will be hemophilic. These are normal, daughter and son, and this is actually the carrier daughter, and last is the affected, you can say hemophilic son. So this is actually a different situation can exist between these two parents. If let's suppose you can see that hemophilia A exists mostly in male, but female are less affected by the hemophilia A. Why? Because in that situation, female will only affected by the hemophilia A when both the X chromosomes will be affected. But if there is one X chromosome is affected, then you will never see the hemophilia A. Let's suppose if we take another example, so you can easily understand what's happening. So here you can see that this is the female, and in that situation, this female is actually again carrier. And if the man is also affected by the hemophilia A, this is the carrier female and this is the hemophilic person. So in that situation, if this X chromosome exchange with this, then what will happen? You will see the daughter, which is actually the carrier. If this X chromosome exchange with this Y, then you will see the son, and that son will be the normal. But if this X chromosome exchange with this X chromosome, both X chromosome in that situation are affected, then you will see that this is the female which is affected by the hemophilia A. and you will see if this X chromosome exchange with this Y, then in that situation you will see the son also affected. So in this case, one daughter and one son is affected, one female is carrier and one son is normal. So this is the situation, and there are a lot of rare cases that the hemophilia A exists in the female, because in that situation you both the X chromosome should be affected by the hemophilia A. So this is the general overview that will help you in the understanding of the genetic lineage of the hemophilia A. Next, if we talk about the clinical features. So in clinical feature, before we discuss, you should know the most important point. You should know that the two components are important in the formation of the clot. When someone get injured, then two important components should be active in the formation of the clot. So first one is the clotting factor. Clotting factor are basically first component, and second one is the platelet. So these two basic components should be normal or in proper state in the formation of the clot. But if any one of them is affected or deficient, then it results in the lot of bleeding in the body. So we are talking about the hemophilia A, then actually it is actually a defect in the clotting factor. So if there is a defect in the clotting factor, you will see the bleeding internally. You will see the internal bleeding in the clotting factor. But if the platelets is affected, then you will see the external bleeding. External bleeding. So this is the most important. Like if we take the example, then bruises, formation of bruises on the skin, and a lot of mucosal bleeding, which is actually the external. But in internal, when the bleeding occurred in the joint and different muscles bleeding is actually the defect in the clotting factor. So if there is a defect in the clotting factor, you will see the internal bleeding like the muscles bleeding, and when you will see the defect in the platelets, you will see the external bleeding like the mucosal bleeding and bruises formation on the skin. So in hemophilia A, which is actually a defect in the clotting factor, then you will see the internal bleeding. Like first one is you will see the hemarthrosis. Hemarthrosis. You will see the formation of the blood clot in the joints. So here this is actually the hemarthrosis. Next is you also see the muscle bleeding, or you can say hematoma. You will see the formation of the hematoma in the muscles, and you will also see the hematuria. Hematuria means you will also see the blood in the urine. So this is also the clinical features of the hemophilia A. And the most important is you will see the hemophilic pseudo tumor. This is very important clinical features of the hemophilia A. Hemophilic pseudo tumor. This is not a tumor. As name indicates, pseudo, false tumor. Actually, when the bleeding or the hematoma forms inside the muscles or bone, like if you see that this is the formation of the hematoma in the muscles, and when repeatedly hematoma, or you can say bleeding start inside the muscle, and you will see lot of accumulations of the hematoma. So in that situation, they a state reach when the hematoma is surrounded by a cyst like structure. So as you can see on the screen that this is the left hip, and you will see the lot of hemophilic pseudotumors in the MRI. So MRI T2 weight is important in the diagnosis of the muscles hematoma, as you can see on the screen, left buttock, or you can say hip MRI. So in that situation, hemophilic pseudotumor is surrounded by a cyst, and you will see also see the lot of inflammation around the hematoma. So, and you will see tooth extraction. When we extract the tooth, then bleeding will start and will continuously for a long time. And you also see that the GIT bleeding. This is normally happens in more severe condition, GIT bleeding. So this is the clinical features of the hemophilia A. Next, if we see the carrier detection in the antenatal, during gestation period, we can also diagnose whether the person is affected by the hemophilia A or not. So we can detect in the antenatal state, during gestation state, by the two methods. First is the chorion biopsy. First one is the chorion biopsy. Like you will see that this is the placenta, and here is the fetus, which is surrounded by the membrane, like lot of membrane like chorion, amnion. So, and here you will see that this is the umbilical cord. This is the umbilical cord which attached to the placenta. In chorion biopsy, we take some tissues from the placenta, and we in that situation we continuously do ultrasound, and through the ultrasound monitoring, we take some tissues from the placenta, and it will help in the diagnosis of the defect in the DNA. If we take some tissues and we check it genetically, then it will help whether the fetus is affected by the hemophilia A and or not. So this is the first method. Second method is the, we can take blood from the umbilical cord. We insert this syringe, and we can also take the blood from the umbilical cord and diagnose whether the factor 8 is in proper amount or not. So these are the two methods for the detection of the carrier state or the hemophilic state. Two methods, chorion biopsy, and second one is the umbilical cord sampling. So these are basically the two methods. Next, last is the laboratory findings that will help you in the diagnosis of the hemophilia A. First one, platelet count. So you people tell me that whether platelet count will be normal, low or high. So in hemophilia A, as we have discussed that the hemophilia A is defect in the clotting factor. So in that situation, platelets will be normal. You will see that like CBC report, then in CBC platelets count will be normal. PFA 100, this is actually platelets function assay test. This is actually used for the detection of the is there any defect in the platelets or not. So this test is basically performed to check the function of the platelets. So in that situation, PFA will also be normal, because this is used for the platelets, but in hemophilia A, platelets are normal. PT, the main clotting factor in the PT is basically the clotting factor 7. PT, in PT you will see the clotting factor 7, which is most important. So in that situation, this is actually a defect in the factor 8. So in that situation, hemophilic person, PT will also be normal. And APTT, the most important components like 12, 11, 8, 9. So these are basically the normal clotting factor. In that situation, you see that here is the clotting factor 8. So in that situation, PT will be abnormal. This is abnormal. PT will be normal because it involves the factor 8. And last is the factor 8 assay. Obviously, it is actually a defect in the factor 8, and you will see that the factor 8 assay, or you can say factor 8 in the blood, will be low. So in that situation, the factor 8 will be low. So these are basically the laboratory findings for the diagnosis of the hemophilia A. So this is all about the hemophilia A. If you have any question, then you may ask in the comment section. Thank you.